In the winter of 2019, China became the epicenter of a new strain of coronavirus. Health officials traced it back to a wildlife market in Wuhan City. This is COVID-19. Based on a WHO report dated 24th February, 88% of infected individuals experienced fever, and 68% of cases reported dry cough among other flu-like symptoms. A report by the Chinese CDC identified 3 vulnerable groups: the elderly, those with weakened immune systems, and those with pre-existing conditions. Currently, scientists believe that the virus spreads mainly through droplets ejected when we cough or sneeze. These droplets are filled with virus particles and may end up in other people's mouths or noses, or directly enter the lungs of an unsuspecting person. A serious infection can result in inflammation of the air sacs, filling them with fluid and compromising the lungs' ability to breathe, as oxygen and carbon dioxide can't diffuse in and out. This is known as acute respiratory distress syndrome, or ARDS for short. Patients admitted to the hospital are often diagnosed with severe acute respiratory infection, or SARI. Since no specific medicines exist for COVID-19, hospitals treat these individuals through supportive medicine, whereby IV fluid, supplemental oxygen, and antimicrobials are used to support the body in its own immune response. Doctors may also note down any recent travel history or any pre-existing medical issues. Combined with close monitoring, most patients are able to recover well. Since the outbreak began in December, many countries have implemented serious measures to deal with the outbreak. China, for example, has built 16 hospitals to deal with the sudden increase in patients. In Hong Kong, the welfare chief, Mr. Law, has strongly advised wearing masks when in public to curb droplet spread. And in countries such as the US, Singapore, and Iran, strong travel advisories and bans have been enacted to prevent the spread of the virus from at-risk territories. There's also been a push to close or even cancel mass gatherings. Many office buildings have started doing temperature screenings. All but one set of entrances have been closed, and security have been equipped with thermal cameras stationed at these doors in order to ensure that all visitors show no signs of fever. So, what can we do? The WHO strongly recommends that we frequently wash our hands thoroughly with soap or alcohol-based rubs and wipes, as COVID-19 is a relatively easy virus to destroy with simple disinfection. Furthermore, it is important that we refrain from touching our faces, especially our eyes, nose, and mouth, to prevent inadvertently allowing the virus to enter our respiratory tract. Soon, we may begin to see more widespread social distancing, remaining at least 1 meter or 3 feet away from coughing individuals. If we do suffer from coughing and sneezing ourselves, we should practice respiratory hygiene and use tissues. Afterwards, be sure to throw them into a bin with a closed lid to prevent further contamination of the environment. If you do happen to start developing symptoms such as a runny nose or headaches, there's no need to be alarmed. The WHO recommends staying at home to prevent overcrowding hospitals. You should then give your GP or medical care provider a call to ask about proper procedures. Contrary to popular belief, the WHO actually recommends that healthy individuals do not need to wear a mask all the time. Instead, masks are only necessary if you're attending to patients who are suspected of having COVID-19, as is the case for nurses, doctors, and those working in hospitals. In fact, the WHO states that there might actually be a shortage of masks and gloves due to the outbreak within hospitals. However, you must use a mask if you are experiencing symptoms such as coughing, sneezing, or a fever. Masks must be used in conjunction with frequent hand washing to provide any protection. Before putting a mask on, it is important that your hands have already been thoroughly cleaned and disinfected. When putting on a mask, be careful to only contact the ear straps to prevent contaminating it. Furthermore, try to reduce all air gaps between your face and the mask so that contaminated droplets cannot bypass the mask barrier. As soon as the mask turns damp, it must be thrown away into a closed-lid bin. Single-use masks cannot be used twice. There have been many instances of panic buying of daily use goods such as toilet paper and stocking up on canned foods in the recent news. This season, let's all try our best to remain calm and informed, observing the necessary best practices without promoting fear and hysteria in our communities. Thanks for watching, and be sure to subscribe for more and follow us on our Twitter.